I'm Dr. Dean Wright. I'm a chiropractor here at South Pointe Physical Rehab. Today we're going to go over functional dry needling with electrical stimulation. So with dry needling, what we're trying to do is we're trying to find those trigger points in the muscle belly and then insert a needle to help those muscle tissues relax and allow them to get their full range of motion. So trigger points can cause a lot of pain where the trigger point actually is and the surrounding area. So I am level 1 certified through Kinetic Core, and today we're going to be dry needling the forearm extensor group. So after the exam and the physical exam, and we find out what tissue is causing this pain, what your pain generator is, that's when we'll decide to do dry needling or not. So we use a clean needle technique, meaning we make sure the area is clean before we do any needling, before we insert any needles into the skin. So we use an alcohol pad to clean the area first. And a common question I get is dry needling the same as acupuncture? And it's similar in that it uses the same needle, very small needle, but it's different in the philosophy and the objectives that we're trying to get. So with dry needling, we're really focusing on palpation findings as well as motor weaknesses in the body. So clean the area. We're going to use hand sanitizer, clean my hands. This is the package that the needles come in. So the most common finding with the needle, it really depends on the severity of the trigger point, but you will experience maybe some dull, achy pain, which is normal. The more you do dry needling, the easier it gets. Your soft tissue quality will get better, the muscle tissue health will get better. So you might experience some dull achiness, but if there's any sharp, sparkles, tingling pain, that would be something to let me know, and then we'll redirect the needle, but that doesn't happen very often. So we find the trigger point, the area where we want to insert the needle, and once we find that area, I'm going to place the needle up to the skin, and then it's going to be a light tap. Okay, so a light tap into the skin, and then we'll start inserting the needle into the muscle tissue. We're doing a cross fiber technique, going across the muscle fibers, and also pistoning back and forth. Sometimes we'll get a twitch response, which is the muscle reacting to the needle stimulation, and the muscle actually twitches, which is a good thing. We're trying to get that. So once the needle is in, we can place needles in different areas, and we can connect them all, close the circuit with a stimulation machine. So this is my dry needling stimulator unit. So what we're trying to do with this is increase the neural activation to the muscle tissue. Sometimes we'll find if the tissue is unhealthy, the soft tissue is unhealthy, the patient will feel the pulsing, but we won't actually see a contraction. So we want to see the muscle moving, shortening, and lengthening. That tells me that it's a good, healthy muscle tissue and good, healthy neural activation. So I'm going to tell the patient, we're going to start at 0, and then we're going to go up from there. I want them to tell me when they feel the pulsing, and then from there, I'm going to go up until it's strong but comfortable. So let me know when you feel it.
I feel it.
Okay, comfortable?
Mm-hmm.
Go up a little bit. Do more.
Mm-hmm.
So on Sierra here, there's a little bit of activation more proximal to the needle in the elbow, and her fingers were moving a little bit. So a little bit of a decreased activation of what we'd like to see. So now I'm going to take it off, and then we're going to go up in frequency but not intensity. So instead of pulse, pulse, it'll be pulse, pulse, pulse. Feel that?
I feel it.
All right. So this tool is a treatment tool, but it can also be a diagnostic tool to see how that muscle tissue is really functioning.